mitigations like you've just stated. What are some of those things that look like immediately, and how far away are we from that?
Well, as I say, if the numbers keep going in the wrong direction, we will need to impose further mitigations. I think we all remember what phase 3 looked like or phase 2 looked like. Those are all things that are under consideration. Remember that it's the exposure that people have to one another. The way they expose themselves, in other words, wearing a mask or not wearing a mask, whether they have distance from one another, those are all the things that affect whether the virus is going to be spread, whether you're indoors in greater numbers than you should be, and so on. And so all of the things that we looked at and did over the last 6 months are things that are under consideration for what those new mitigations might look like. But let's just be clear, you can go look at all of the mitigations that we had in previous phases of Restore Illinois, or in the mitigations that are in the resurgence mitigation list, tier 1, tier 2, tier 3, which have been on the table on a regional basis. All of those are frankly, potential mitigations that we would put in place statewide.
I had a question from my colleague, John Garcia. You talked about enforcement, local enforcement.
Yes.
There's a report out of McHenry County, 90% of businesses, even if that number seems high, it's significant. Even if that number were lower, 90% of businesses not complying with the indoor dining ban. Even if local law enforcement was really trying to enforce this, I mean, when you have that many people
believe me, when one of them gets a citation, others hear about it. When 5 of them get a citation, all of them hear about it. They know that if there was enforcement, if there were actual consequences for their actions at the local level, and they're supposed to enforce state laws, state regulations, state laws, that is their job. And when they don't enforce them, people die. Yes, sir.
Yesterday, Dr. Ezike said that we should be testing ourselves more and more, perhaps even if we don't show symptoms. Do we have the capacity to sustain that kind of testing?
We've been building that precisely for that purpose. We want people, in fact, it was part of my remarks today, just to remind you that even when you're not feeling symptoms, if you feel like you've been exposed to people or in an environment in which you could have contracted COVID-19 and you're not feeling symptoms, go get tested. And that's one of the reasons, I mean, frankly, that I think our state has been, over the last number of months, better off than many others, is that we have so many tests available for people to get. We want people to do it. We want people, even when you're not feeling symptoms. Look, early on here, you remember that we had to tell people, like, please don't get a test until you have symptoms, because there just weren't enough tests, right? That was very early in the pandemic. Now we're literally the 3rd largest testing state in the country. That doesn't mean that everybody can go every day and get a test and we'd be fine. But, at 80-some thousand tests per day, and you've seen we've steadily increased that from 60+ thousand, 70,000, 80,000. We're heading toward 90, 100,000. It won't be enough until we can start to get the virus under control for everybody to get a test all the time. But as I say, if you feel like you've been in a place where you may have come in contact with somebody who has COVID-19, go get tested. And yes, we have the capability to do that. Yes.
I have an off-topic question. Is that okay?
Sure, of course. I mean, unless anybody else. Yeah.
All right. This has to do with unemployment. Today, the new numbers from last week came out, and there were more than 73,000 new unemployment claims filed in Illinois, which was a 38% increase from the week before. Not all that surprisingly, considering the new mitigation efforts.
And considering the situation of the national economy too, because we've seen this happen in other states too. Yeah.
And I'm sure a fair amount of those people, we could assume, are restaurant workers and bar workers and such too, who may not have their jobs. But that aside, considering that's a 38% increase from the prior week, and for example, there are still more than 153,000 PUA claims that have not been paid out yet in the system. Are you concerned about how IDES will be able to handle this second surge And could you elaborate on anything new that's being done to potentially prepare for another round?
Sure. Well, let me be clear. IDS is in a much better position today than it has been at any time during this pandemic. Many upgrades have been implemented. We have a new leader at IDES. She's doing a terrific job. We've brought in technology to help us with processing to make sure that we're answering, calling back people much faster. Obviously, any increase in unemployment claims is tragic for the people who have to endure that, and it makes it more difficult to catch up and make sure that we're responding to people very quickly. But people are getting called back, and they are getting their unemployment claims met. You know, more is worse for our state. More is worse for our state. There's no doubt about it. I also want to be clear that you talked about the PUA system. That system is rife with fraud all over the country because the federal government set it up wrong. And so there are literally weekly calls among all the states to discuss how they're going to manage dealing. You know, the FBI is involved in this, the Justice Department is involved in this, our Attorney General's office is involved in this. It's a huge system that got created with, you know, frankly, that's allowed people to, using stolen identities or, you know, trying to figure out somebody's name and using it in a PUA application. And so to the extent that people are not getting those PUA, you know, benefits filled, one of the challenges has been the massive fraud that the federal government kind of built into that system. And that's going to have to be worked through in every state, and every state is working on it. We're actually in a slightly better position dealing with that than many others.
And a quick follow-up, are
Yeah.
you concerned about the state's ability not to pay out the claims, but to pay for them? I mean, I understand there's a trust, correct?
Well, the PUA system is all federally funded.
Okay.
So the answer is, I mean, my concern is that your federal tax dollars were wasted by the fraud that was built into that system.
And regular unemployment claims, are you concerned about the state's ability to absorb that cost?
Well, I'm concerned every state's got the same problem. Every state has massive unemployment claims that it's paid much more than they expected. We too have that problem. And so, you know, we'll work our way through it. It's certainly help that we'll need from the federal government to support unemployment for every state and for the state of Illinois as well. And obviously we have an agreed bill process to work through business and labor working together to make sure that system is solvent.
Just to follow up on the stricter mitigation. Sorry.
Yeah.
I'm good, thank
You're
you.
good, okay. On the possibility of stricter mitigation.
Yes.
You said in the past, it takes a couple weeks for the resurgence mitigations to take hold.
It does.
And really evaluate that. Are we in a place where you are evaluating what's been happening?
Yes.
And you think that the resurgence mitigations are not working?
Well, it is clear that the numbers continue to go up, even in places where we put those mitigations in place a couple of weeks ago or 3 weeks ago. And so as we watch those numbers, I mean, again, nothing's exact here. This virus doesn't follow an exact, you know, path or timing. But 2 to 3 weeks, and I look to Dr. Ezike, 2 to 3 weeks is at least a time in which you can start to see, is there a bend in the curve? What's happening? By the way, the virus, you know, it doesn't slow down. The virus does what it wants to do. The question is whether people are following the mitigations that have been put in place. If they're not following the mitigations that are put in place, then no mitigations that you announce, you know, or if you don't enforce them at the local level, like we were talking about earlier, guess what? And if people aren't following them themselves, which is much preferred, enforcement is, you know, your secondary measure. People should just do the right thing here for themselves and their families. And ultimately, we do believe these mitigations work, but people have to follow them. And I think that, you know, just as importantly, some mitigations are less effective than others. Obviously, we saw back in the spring a complete stay-at-home order, not something right now that we're considering, but you know, that worked, right? You saw that from the moment we put it in. Remember, it took 6 weeks from the moment we put it in for us to see a peak, and then begin to come down the other side. You remember? And it was about, you know, March 21st to about May 6th. Now, that's to get to a peak, right? You can see in the middle of it whether the curve is bending. And then you want to hit a peak and, you know, start going the other side. We're looking for the curve to bend. Right now, it's in a linear fashion heading up.
All
right, we got to get to some questions from the internet. John O'Connor is asking, Wednesday you said you ran for governor to handle the budget responsibly because revenue never matched expenditures. Then you signed a budget with a $5 billion gap, hoping for federal aid that hasn't come. Was that responsible? Why should taxpayers believe you can fix this?
Well, I don't think anybody thought when I was running for governor, nor did I, that we would have a pandemic that would take billions of dollars out of our state budget. And I did balance the budget for 2020. I balanced that FY 2020 budget, and we were running ahead on that budget. We actually had a surplus running under the budget that I got passed. But along came a pandemic, and that'll put a multi-billion-dollar hole in anybody's budget.
This is from Rich Miller at Capital Facts. I'm hearing increasing anecdotal reports of long lines at testing stations. Representative Deb Conroy related a story today. Is there any evidence that this is a widespread problem, or is it confined to certain areas, and what's being done about it?
I would say whenever we discover that there are long lines, untenably long lines, obviously if people have to wait a little bit, that's not bad. If they have to wait hours, that's bad. Whenever we hear about those, we start to increase testing capability in that area. Sometimes we move mobile assets into the area. Sometimes we go to the hospitals or other medical providers and ask them to start or expand implementing them. The fact is that we're trying to react wherever we see that, and when we hear about it, it's not a good thing, right? It's something we want to address everywhere in the state if we hear about it, and I hope people will report that to us.
Dave, Tony at WBZ, and a few other people are asking about Senator Durbin's comments yesterday, and if Speaker Madigan should remain chairman of the Democratic Party in Illinois, and what role do you think his investigations played in voters rejecting the fair income tax?
Look, I agree with Senator Durbin that, opponents were able to tap into voters' concerns about corruption and their lack of trust in government. There are real challenges there, and you know that I have proposed significant ethics reforms that I know that the legislature needs to take up. The Republicans and the billionaires that sided with them were, effectively able to use the speaker as their foil, and that hurt our state's ability to get things done. And the truth is that Democrats are standing up for the middle class and getting important things done to support them. But it is clear that Senator Durbin is expressing something that I think is accurate.
Does the state still intend to borrow money from the Fed's MLF program, and if so, how much and when?
It's a good question. First of all, with the fair tax being defeated by the Republicans and the billionaires, the fact is, as I have said, we're going to have to make drastic, really painful cuts, and that's just the kind of immediate challenge of the budget. And then add on top of that the failure of revenues from COVID. And so MLF will no doubt have to be part of the solution, but we need to make other structural changes, and I've asked the leaders to step up, and I mean of both parties, to step up with proposals to do that.
And we have a follow-up question. To be clear, you agree with Senator Durbin that we need new leadership at the party?
Yes.
Jim Leach is asking, with local governments still defying orders to close indoor bar and restaurant service, at what point do you step in and assert your authority to address a statewide public health crisis?
I'm sorry, can you repeat the first part of that question?
With local governments still defying orders to close indoor bar and restaurant service, at what point do you step in to assert your authority to address a statewide public health crisis?
Well, if they are not enforcing those local mitigations, then once again, moving the state backward, which is bad for every industry and bad for every individual in the state, frankly, other than it's going to bring down these metrics and these positivity rates and cases, which will be good for everybody. But if you want to keep the economy moving forward, they ought to go enforce the mitigations that we put in place.
Shruti at Bloomberg and Jamie at the Tribune both have similar questions. How soon could we see a hospital bed shortage occur in Illinois, and in what regions are we worried about And are there any plans to build any alternate care for sites or open any of those?
I think that's all on our website. You can see what the capacity is, I think, in every region on the website, hospitalizations, capacity levels, so that's all available to you. Please go to the IDPH website.
I think we got almost everything. Let's make sure. Yeah, I think that looks like everything.
Great. Thank you, everyone.
Thanks for watching, and if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching.